Hi, greetings, my fellow Ghanaians. This is Dr. Atakobna Kennedy coming to you once again. I want to thank you for the responses I had last week to the small talk I delivered on stroke. Today, due to popular request, I like to take on diabetes for a couple of reasons. It is very common indeed. According to a report published in 2022, there are about 4.2 million Ghanaians with type 2 diabetes and another 4.5 million who have pre-diabetes. It means that if you put the two groups together, it's about 8.5, 8.8 million, and that will be almost 1 in 4 Ghanaians. And that is not surprising. Here in the US, the prevalence is between 9 and 10% for diabetes itself, and pre-diabetes is running quite high too. So why is diabetes so important, and what is it? This is just a conversation to the general public, so I don't want to be too technical. The doctors here, after you hear me out, take it up with your patients and your friends and your family and go into details. But the definition of diabetes essentially has 3 elements. It is chronic hyperglycemia, or your sugar is too high. That's the first thing. 2, it leads to some metabolic disturbances that affect your protein and fat metabolism. And the third thing is that this is normally due to either a deficiency of insulin or the body's resistance to actually higher than normal levels of insulin. So what are the signs and symptoms of diabetes? Normally, people who have diabetes might pee a lot, or they drink a lot, and if it is type 1, they lose weight. If it is type 2, actually, most of them don't have that many symptoms, but there are other things like women who have chronic yeast infections, women who deliver big babies, people who have frequent skin infections. All those things are tip-offs. But in actual fact, a majority of diabetics these days are picked up through routine screening. And the screening guidelines are that if you are 45 years old, you should be screened for diabetes. And after the first screening, you should be screened about every